Well, welcome back and thanks for being with us here on Morning Live. The South African Medical Association says it will interrogate the full report on the state of hospitals and it will raise its findings with the relevant authorities. Now, this week, the Public Protector's Office released findings of inspections at 17 public hospitals across the country. And they found several irregularities, including a shortage of staff, dire shortage of personal protective equipment, poor quality, and of course, wrong size of PPE, and in some cases, personal protective equipment that was simply not delivered to hospitals. So to talk about this a little bit more, we're joined by Dr. Mvuyisi Mzukwa, who's the National Vice-Chairperson at the South African Medical Association. Dr. Mzukwa, thanks for your time. Welcome to Morning Live.
Good morning, Sakina, and morning to your viewers. Thank you for having me to represent the South African Medical Association in your program. Thank you.
Dr. Mzukwa, just honing in on that report. The report notes, as I mentioned in that introduction, shortages of, in addition to PPE, oxygen points and thermometers, disposable bins, among others. How bad is the situation really at public health facilities, especially now with the second wave of the pandemic?
Thank you so much, Sakina. I think the report really to us is not didn't highlight new things. We've always been raising the challenges that are being faced by the institutions at the grassroots level in terms of your hospitals and your clinics, and how it affects, the working environment and also the morale of the healthcare workers. But we've always mentioned, all these things. I mean, we've even had at some point some protest marches that we had, to highlight, these problems in the healthcare sector. But I think what we have noted was that we have a government that would paint out a rosy picture to the public and hide what is actually happening on the ground. The public protector really confirmed our complaints that we've been bringing up to government, for their full attention way before the coronavirus came into our country. And if you look at the issues that are highlighted there, they specifically talk about the human capital. They speak about equipment, infrastructure. I mean, even housekeeping. The shortages of staff, broken X-rays department, all these things that we've always been highlighting. And also our disappointment was when, the public was told a lie. I'm not afraid to say it was a lie. When the public was told that the South African government, the health department, is ready for coronavirus. I must say that this was the biggest lie we've ever had as the South African Medical Association, because we knew that the hospitals are going to collapse because they are not ready. And on top of that, I think when they were saying they were ready to steal from the public, nothing more, but they were ready because there were companies that were formed literally to steal from the public. So I don't think there's anything new that the public protector has raised, but we are very glad that it was raised from that perspective, because at times you are taken as if you are a political party or a political formation of some sort when you raise issues. Pertinent issues that you raise for government to attend.
Dr. Mzukwa, those are very, damning allegations against government. And when you say that the hospitals were not ready, can you take us into your confidence and tell us about the discussions then that were had? Because the public was told we are ready. And now we are facing a second wave of COVID with a new variant of the virus, and we are told this is spreading more rapidly, and already hospitals are filled to capacity. So are we ready to deal with the second wave?
How are you ready when you have shortages of doctors, when you have shortages of nurses, porters? In some hospitals, you don't even have transport because it was attached by the sheriff. How are you ready when you have dilapidating hospitals, when you have linen lying around with poor ventilation around? When health and safety issues have never been attended to? We have departments in government who are sleeping on the job, like the Department of Labor, for example. The Department of Labor is supposed to be inspecting all these institutions, and actually they're supposed to do what we call a risk assessment, where they assess the risk, the hazards that may be, employees might be exposed to. And they've never done that. In many hospitals, in many institutions, they've never done that. Instead, they come up with this PPE thing. I mean, if you know how we deal with hazard in the workplace, we have what we call the hierarchy of controls, where we have administrative controls, engineering controls. We have PPE is just down there. You don't start talking about PPE when you have not talked about engineering controls and administrative controls. And that is what we have always been highlighting. So to say we are ready, you can be ready, to do something else, as I said. You can be ready to steal from the poor, but you can't tell us you are ready when it comes to the issues of the hospitals, because we have seen for ourselves and we have told government that you are not ready, but instead they run around with blue light cars and all those things, in a very disturbing way. And also telling healthcare workers that healthcare workers are heroes. I think that is a mockery to healthcare workers to tell them. I mean, those healthcare workers who have died, they must be turning in their graves to say that they are heroes. What heroes? Do you have heroes that you give them, you don't arm them when you send to the battle? Do you call them heroes when when you fail to provide them with the necessary equipment to fight the enemy? And then you come around and say, these are heroes. It's a mockery. And I wouldn't like, that word to say we are heroes as healthcare workers. To us, it's a mockery. And I think government should stop using that word, because to us, it really it's a lip service.
So these are very serious issues, and I'm wondering what sort of impact does this have on, firstly, staff morale, and then in the second instance, the way in which medical personnel, frontline staff at this point then go about doing their jobs in trying to help fight this virus. How are things impacted because of what you have highlighted, Dr. Mzukwa?
It has impacted badly on healthcare workers. The worst that has happened is that they have died. Healthcare workers have died, and this government has its hands full of blood of healthcare workers, because they never provided good personal protective equipment. They were not ready, but they insisted that healthcare workers must be at the forefront. That also impacted badly on their mental wellness. We, on the side of the profession, decided to support this in terms of partnering with the SADC, the guys who are giving psychological support and all those things. But on top of that, we had our colleagues admitted to hospitals. We have our colleagues told that they can't use a special leave when actually they have been infected in the hospitals, in the institutions. You can't take a special leave. You must take your own sick leave. When you work you've been infected in the workplace. How do you take your own leave, your own sick leave, when you are infected in the workplace? It has impacted badly because there's shortages in the hospitals. It causes some of our colleagues to be overworked, to have all these mental challenges because they are subjected to all these psychological factors in the workplace. And you highlight those things to government officials. It's like you are talking to I don't know, people who can't listen, people who don't have ears, you know, to listen to the healthcare workers. So this is what has happened. They've infected their own families because they've been given poor quality PPEs. Sometimes they not, I mean, how do you even go on and repeat the same mask that you've been given, the same suit, you use it the whole day? How do you say you're protecting workers when something like that has happened? So it has had dire consequences when it comes to healthcare workers in terms of their lives and also their livelihoods.
Dr. Mzukwa, you have committed to raising these issues with the relevant authorities, issues like the poor quality and sometimes the complete absence of personal protective equipment has been raised. How certain are you that proper action will be taken to rectify the situation at this time and, you know, given the way it was handled previously?
Well, what we have done now is to engage directly with the provincial departments. We recently had a meeting with the department in the Northern Cape. We're still arranging other meetings with the relevant departments in other provinces. You must remember, Sakina, that the main problem in this country is that even if the Department of Health is fragmented, you have 11 departments of health in South Africa. You have the municipalities, and you've got all these other provinces, you know, who are working in a fragmented fashion in terms of relating to the national government. Then you have that national government sitting there. I mean, the MEC, as you know, they are not reporting to the minister. They report to the premiers. So whatever the minister says, it doesn't matter. They still do their own things. They still use their budgets in the way that they want, in the way they feel, even if that grant comes from the national government. So those are the issues that we've been raising, to say that if you are saying you want to solve issues, deal with this fragmentation. But on top of that, I think at some point, it will take class action, you know, to sue this government, to say, you've killed our workers already. I think it's time that we turn the tide against you.
Well, Dr. Mvuyisi Mzukwa, thank you so much. National Vice-Chairperson at the South African Medical Association, talking about the report by the Public Protector's Office on the state of public hospitals amid the second wave of the coronavirus pandemic, and also very scathing about what has been done, the interventions, talking about how our healthcare facilities have never been ready to deal with COVID, let alone the second wave of the virus. So we look forward to hearing your views on it. But as you heard there from Dr. Mzukwa, they do intend addressing these issues more pointedly.